Hey, deserving listeners. The other day, I put out a call on the Facebook fan page and on the Discord channel asking people to submit their questions about narcissism, and I thought I would answer those questions here. First person wrote in saying, what are things we should avoid doing when dealing with narcissists? What are things we should avoid doing when dealing with narcissists? End of question. The first thing I'll say is, what do you mean by narcissists? Because the internet means a lot of different things by that. Sometimes they're referring to narcissistic personality disorder, which I will tell you that the vast majority of lay people do not understand what that means. And many clinicians in my anecdotal experience also don't understand what narcissistic personality disorder is. So are we talking about, oftentimes on the internet, what I think people are talking about are psychopaths or antisocial personality disorder. Because a part of being a psychopath is to be narcissistic. And I wonder sometimes if people are talking about psychopaths, meaning that these individuals don't have compassion or care for other people. They're very callous. They're con artists. They use other people, which is a very different personality than a quote unquote someone who suffers from narcissistic personality disorder. Or are we just talking about someone who's really self-centered, in your opinion? But anyway, if you know what are some things you should do when quote unquote dealing with a narcissist? Well, the first thing I would say is try to understand their trauma. This is what I do because it helps me to have compassion for them, which I consider to be a central, virtue. But the other is that it explains a lot of their behavior. If I'm feeling put down, if I'm feeling discounted, if I'm feeling devalued, and I have a satisfactory conceptualization of their narcissistic injury as a child and their compensation for it as an adult, then I can interpret what's happening with much less stress. I can say, I feel devalued by this person, not because I am devalued or I lack value, and not because this person wants to devalue me, but because this person feels devalued and felt devalued as a young child and is now suffering from the consequences of that. And so not only do I have compassion for that person, but I also just take it less personally, and I also don't try to fight it, because I'm not going to be able to, if I work with this person, I'm not going to be able to heal their traumas such that they'll stop devaluing people around them. So it becomes a lot easier to cope when I see it correctly. But I'm guessing what you're looking for are like tips on like what to do. And, the internet is rife with articles about, how to deal with a narcissist. And I find that these articles, all of them to be, my perception is that a lot of people are out there feeling hurt, which is real. And they've been harmed by someone. They've been dumped or broken up with or cheated on or fired from a job or abused or yelled at or harmed in some way. And they are having a hard time coping, which is real. And all that is real. The hurt is real. Being dumped hurts. Being broken up with hurts. Being cheated on hurts. Being abused hurts. Those are real things. And the individuals are looking for some kind of label to put on the person that hurt them. And they come across all this literature on the internet, quote unquote literature about narcissism. And it seems right because, when you're harmed by someone, there's a natural conclusion that this person doesn't, and I've talked about this before, but so let's say that you're in the beginnings of a breakup with a relationship. You've been with him for 7 years, and he's cheated on you recently. He's not returning your phone calls, or he's not being very nice, or you cry and he just stares at you or something, and it's hurtful. And you're looking at this person, you'll be like, I don't feel like this person cares about me. Or when you're saying you're just so sad that you're breaking up, she just stares blankly at you like, yeah, well, anyway. So it feels very hurtful in the moment. That's real. And no one can take that away from you. That's valid. But then we start wondering, but why is she doing this to me? Why is he doing this to me? A common reason is because they're just not into you anymore. Or you were a jerk face to them for 5 years and now they're just fed up with you or whatever. There's a lot of reasons why people break up with people. But those are harder to swallow or harder to imagine, whereas a very easy conclusion is that person, there's something wrong with their psychology. They are being cold to me and, unnice to me because there's something wrong with them. What's wrong with them? Well, they seem very self-centered. They seem very unwilling or unable to see my pain. So they're kind of like more focused on themselves and they're selfish because they're focused on their needs and not mine. Let me type that into the internet. Well, instantly you get all these hits on narcissism, which is a huge leap from someone's breaking up with me and doesn't seem to care about my feelings to that person has narcissistic personality disorder. And so I think but anyway, because narcissistic personality disorder is an extremely rare condition. Contrary to what what I believe to be extremely dubious researchers out there, I think Twenge, there are people out there that are claiming that narcissism is on the rise. And I've done a whole deep dive. I can't remember what I called it, but if just go to my website, our website, and type in to the episode list, type in narcissism or something. There's maybe I called it like, are we becoming more narcissistic or something? And it's a very difficult question to answer. And two, there doesn't seem to be any evidence that we are becoming quote unquote narcissistic. If anything, we're just becoming more self-confident, which is a good thing. You want children and young adults to believe in themselves. You don't want them to feel superior. There's a difference. Okay. So your question is, what are things we should avoid doing when dealing with narcissists? Well, you should do whatever you do in any relationship. You should think about, are your needs being met? Maybe you have to draw boundaries if you're being harmed. So, there's nothing about someone with narcissistic personality disorder that would say like, with these strange humans, you have to do this whole different set of behaviors. It's the same that you would do in any relationship. And what I'll say, what I've done in relationship, and everyone with narcissistic personality disorder is completely different. I mean, I know dozens of people clinically and otherwise who have narcissistic personality disorder, and they're all completely different. Having a personality disorder does not describe who you are. It's just a part of your schemas and a part of your traumas, really. And says, someone with PTSD, you wouldn't say, oh, that person has PTSD. I know who they are. Of course you don't. The same with narcissism. So if I, off the top of my head, when I think about a handful of people that I've had in my personal life who have been on the narcissistic spectrum, some things that I do are I have low expectations regarding them listening to me. So I don't try to get my needs met from them listening to me, like intently, like really listening to me. I also, what else do I also go into interactions with them knowing they're going to talk a lot. So I just, have that expectation. They can also sometimes be kind of exhausting, not always, but so I have to take them in bits and pieces. I can't, of the people in my life who are on the narcissistic spectrum, it's hard for me just to like hang out for long periods of time, unless they're lower on the spectrum. Like Umberto, for example, is self-described as on the spectrum. And I think we've identified him as being like 15% or something, which is pretty low, but it's there. I can hang out with him, but other people that are in my personal life, and this is mainly in the past, years ago. Anyway, point is that there's that. I will also potentially not expect them to understand me when I say that I've been hurt by them because of their, narcissistic perceptual problems. It will be hard for them to accept they've done anything wrong. And so I, with varying levels of success, will avoid trying to get them to admit that they've done something wrong. So there's that. But yeah, let's go on to another question. All right, this next question. Where's the line between narcissism and healthy self-worth? It's a great question. Huge topic, but in a very small nutshell, I will say that and this is where the confusion with twenge and all these notions of society becoming more narcissistic. And if I remember right, when I looked into the research, so there's a group of researchers going around, particularly on like right-wing media channels, talking about how young people today are narcissistic and millennials are so self-centered, and everyone who has a selfie stick and everyone who has an Instagram account, everyone's so narcissistic today. And it's tempting to believe, I guess, for some people, but as a skeptic, I am always like, well, where's the evidence and what do we mean? And when we look into the research, there, you could just do a whole, listen to my whole deep dive. Let me look up the name of that episode, actually. The episode is called Are Millennials Narcissistic? This was published in the end of 2018. Are Millennials Narcissistic? It should be on YouTube and all the other places, all the other places where the podcast is. But if I remember right, the research was, these researchers say, we've studied it and people are more narcissistic today than they were 50 years ago. But when we actually look at the way they measured it, they use this one measure that's been around for a long time that supposedly, so the way that these measures work is you give someone a survey, you ask them a bunch of questions, and then from those questions, you score it, and there's usually an index of how narcissistic that person is. And there's like 30 questions. I can't remember the amount of questions, but let's say there's 30 questions. And some of the questions are pretty obviously related to narcissism, like, I believe I am superior. Do you agree or disagree? So if someone believes they're superior, then yeah, they are narcissistic to believe you're superior to other people. But there are other questions on this survey, this measure of narcissism, that says something like, I like myself, or I believe my opinions are important. And when you add up all the questions on this measure, then yeah, if someone believes they're superior and they believe their ideas are awesome and they like themselves, then we start looking at a construct or an index of someone's narcissism. But if, on average, some of the items on this measure are not actually measuring narcissism, but are measuring self-esteem, like a question, I believe my opinions are important, or I like myself. And this is my speculation based on my take on all the research, is that a lot of people, millennials today, have been parented better than Generation X and other people before us. Millennials were parented by parents who understood more about parenting. They understood that kids should not be abused, and ignored. Now, can the parents of millennials be terrible? Yeah, absolutely. But on average, there's a good possibility that parents in Western society are just better with attachment, are less abusive, are more stable than they were 50, 100 years ago. It's hard to know that. And of course, it could be a just so story. But when we look at the research, we find that millennials, when they fill out that questionnaire about narcissism, they're not endorsing more often these items like I am superior, but they are endorsing these items like I believe in myself or I like myself. So it's a possibility that millennials are just healthier than we were in the past, but because of the way that this measure of narcissism is designed, it looks like millennials are slightly more narcissistic than they were in the past. Anyway, so healthy narcissism are things like, so you're asking, what's the line between narcissism and healthy self-worth? Well, healthy self-worth is believing in yourself, having good self-esteem, mostly liking yourself, or liking yourself even though you have some flaws, recognizing your flaws. To be narcissistic is to, on the surface, believe that you are perfect, but underneath that, to feel like you're worthless. To have healthy self-worth is to say, yeah, I'm a pretty good person. In fact, I think I'm pretty rad. I have some flaws, but I even kind of consider it sort of rad that I can recognize my flaws and accept my flaws, that kind of thing. Healthy self-worth involves mostly thinking that you're likable and lovable, mostly believing that you can accomplish things. When people disapprove of you or criticize you or reject you, you have enough self-esteem to weather the storm. You stick up for yourself in a reasonable manner, and you have a normal amount of self-bias. Like, when I make a mistake, so this is a cognitive bias that, for better or for worse, when I make a mistake, it's okay. But when others make a mistake, it's not okay. These are just normal or quote unquote healthy levels of self-centeredness or self-worth. Unhealthy narcissism is a completely different thing. And I want to really divorce these things. Narcissism is not more self-worth. You understand? Narcissism is no self-worth, but you've manufactured self-worth in a fake way to make yourself get through the day. Narcissism as a personality is resorted to in the face of devaluation. And this is something that I find the internet doesn't really understand. I feel like people think narcissists are so full of themselves. No, they are not. Quote unquote narcissists hate themselves more than anyone could possibly hate themselves, but they have a facade of grandiosity and self-importance and superiority because they need that in order to survive. They developed that when they were 2 years old as a way of surviving devaluation, neglect, and abandonment, possibly. So narcissism is the need to believe that you're superior, to distract yourself from feeling like you are worthless. Now, there's a third construct, which is unhealthy self-esteem or non-devaluation-based narcissism. And it's rare, but not a very good look of privilege, essentially. You are a white male, Protestant, heterosexual, cis, rich boy who grew up with privilege and everyone telling you that you're awesome and your parents saying you're meant for greatness and you're better than other people. And you're 20 years old and you operate from that place of superiority. You were raised well enough attachment-wise that you don't have narcissistic personality disorder. So, you're a relatively healthy, differentiated individual, but you've essentially been brainwashed into believing that you're superior to others because that's what people have taught you. And so you operate from that narcissistic superior place. But it's not out of desperation that you feel that way. You've just been brainwashed into believing that. And it's convenient for you to believe that because it serves you to believe that about the world. You know what I mean? So narcissistic personality disorder is resorted to in the face of devaluation. Healthy self-esteem is when you're raised well enough and made to feel like you're lovable enough that you actually internalize that. And then, I don't know what to call this third construct, privileged narcissism or believing you're better than others because of your identities or something. Now, this third kind is malleable. In fact, a lot of people, including myself, honestly, as a male, I grew up with a lot of privilege and wasn't taught about it at all in the 80s, 70s, 90s. I don't remember anyone talking, or maybe people talked about privilege in the 90s a little bit, but it wasn't talked about very often. And so I didn't understand. I was swimming in my own privilege and didn't see what it was like to be outside of it. And slowly learned, I have privilege. And so prior to learning that, I was operating kind of from that third narcissistic place of, in fact, I remember when I was a kid, I was like 7 years old and I was trying to fall asleep at night and I was thinking about gender and all the things that are in the world. Like I was thinking, okay, the fastest person in the world is a man. Superman is a man. The news anchor is a man. The president is a man. The general of an army is a man. Even the best cook, even though cooking is a woman's thing, the best cook in the world is a man. The best singer in the world is a man. And I thought, well, I'm going to be a man. And I remember thinking about that, so this is me interpreting society and trying to figure it out. Now, no one was there to tell me, well, there are systemic barriers set up so that women cannot achieve those kinds of places. And there's nothing inherently different about men and women that makes men better at cooking, for example. It's just that women are denied access to those upper echelons of the field because we live in a very, very sexist society. No one was there to tell me that, and it wasn't obvious when I was 7 years old. But my point is that I remember that moment thinking, men are superior to women. Isn't that interesting? I was just sitting there and I'm sure I'd been told that in very subtle ways and through various different methods. And so in that moment, at the age of 7, staring into the darkness at night, I had narcissism, a very unhealthy version of narcissism, but it wasn't based on my desire to protect myself from my own devaluation. I had just sort of thought that men were superior because that's what society was telling me. And then I was broken of that when I learned better. So, all right, let's go on to another question. I got to go faster. I got a lot of questions to get through. All right, this next question is, can narcissism be taught? Can narcissism be taught? Well, I've already talked about this a little bit, but the answer is yes. The behaviors can be taught, but not the condition. You can't teach someone to have narcissistic personality disorder, but you can teach them to act, quote unquote, narcissistically through modeling or normalization. For example, privilege, like I was talking earlier. But also, if, for example, you come from a family where both your parents were suffered from narcissism, they might not ever apologize. And you as a child, even though you don't have narcissistic personality disorder, might also never apologize as an adult because you've just never had it modeled to you, which could be argued is a narcissistic thing to do. But, it just depends on how you see it. All right, this next question. How difficult is it to open the eyes of someone deeply narcissistic to their own behavior? How difficult is it to open the eyes of someone who is deeply narcissistic to their own behavior? How difficult is it? I would say that it's fairly easy because if you can properly conceptualize of the individual, then you can it will facilitate compassion from you because you will feel bad for the person and their condition. And then if you explain it to the individual from that place of compassion, then, I find that it's very easy for me to explain it to people. The people that I've worked with who had narcissistic personality, I've told them that they had narcissistic personality at some point, and they never resisted. Well, maybe they did at some point. Well, there was one person I talked to, and I've been a therapist for 25 years, so it's hard for me to remember every client, of course, but a lot of the clients that I can think of off the top of my head who had NPD that I worked with, it didn't take long. It wasn't a huge adjustment. In fact, for a lot of them, they rejoiced, and it's similar to how people with borderline will rejoice when they hear me describe how I see them. Because people with narcissism, deep down, have a tremendous amount of needs that aren't being met, and they have no way of navigating the world to get their needs met, but they want their needs to be met. People with narcissism want closeness. They want to have they want to relax enough so that their empathy can come out. They want to have their needs met. They want to be vulnerable, but they can't because of what they learned early in life, and they can't because they're in this compulsive superiority contest with everyone. But underneath that behavior and condition and coping mechanism is a deep, deep desire to be seen and to be valued and to be heard and to be understood. Because the problem with narcissism is that you feel devalued, and your strategy is to make yourself superior, but you know that it's fake. So you never actually get your needs met. You never actually feel valued because you're faking you're faking everyone out, including yourself. And you never end up having any kind of corrective experience. In the same way that the borderline individual is deeply afraid of abandonment, and because of that fear will be hypervigilant, and because of that hypervigilance will push people away, and thus will never have people be secure attached to them or be challenged that way. The narcissistic individual is feels devalued and is desperately trying to get valuation and value from other, to be valued by other people by asserting superiority, but they know it's fake. So they're not, and they actually will push people away, because when you're really high on the scale, people will devalue you because they will notice how narcissistic you are. And so you're not getting your needs met. So when I come along and I can look at them and say, like, this is what's happening, they'll be like, oh my God, no one's ever seen me this way before. Thank you. Yeah. And they'll just, they'll cry for an hour every time I talk to them. So that's what narcissistic personality disorder is. Now, are these individuals annoying? Yeah, they very much can be. Can they be abusive? Yes, they very much can be. These individuals are not necessarily not a train wreck in their life and not causing a lot of damage and harm to other people. But how difficult is it to open their eyes? I find it to be pretty easy. Now, I will say that there is someone I can think of years ago who I treated who had a narcissistic personality, and she wasn't coming. It was family therapy, and she wasn't coming to me for help with her. She was coming to me because she wanted to fix her children. And so with her, I never had any leverage to talk with her about her personality because she was never asking me for help, really. She was saying, fix my kids. But I will say, even with her, even though I recognized her condition, I was able to help her to be more vulnerable and help her. I engineered many corrective experiences with her, even though we never really had the time to talk about why I thought that was helping her. But she, contrary to her defensive schema, became very vulnerable with me and would reach out to me for a lot of corrective experiences, and I provided that. But we just never had the time to really talk about the full picture of her schemas and her problems. And, to be honest, this is something that's, if you're a therapist, I know many of you are, really just anyone out there, it's very important to understand that the way the internet and the way people talk about personality disorders or just personality traits or problems is, I find, very adolescent. When we're children, we're like, you're 13, or at least when I was 13, and you have a teacher that you don't like, you're like, my teacher's stupid, he's such a jerk face, and he, gives us homework, and he doesn't let us talk during class. And when we grow up and we're 25 and we're in graduate school and your teacher's giving you a lot of homework or telling you to be quiet in class, you don't have that attitude anymore because you're a grown adult and you're like, well, I'm paying money for this class, and if we're going to learn something, I have to be quiet, and I also have to do assignments. And so when it comes to personality traits in other people, we're still all 13-year-olds going like, that person treated me bad, they're hateful, I don't like them, they're evil, I'm going to talk crap about them, if I see them, I'm going to push them down a flight of stairs. That's normal when you're 13. But when we're 25 and older, we should be like, I wonder how they got there. And I know many of you are like that. You wouldn't be listening to this podcast if you weren't. But on average, when we see narcissism in other people that's annoying to us, as a society, we're like, something's wrong with, I don't like that person. They're evil. They're doing it by choice. No, they're not. And so when you can have compassion for people, No, backing up. When you could properly conceptualize someone and see them for what they really are, then you just naturally have compassion. When I was 25 and I was going to graduate school and I had a teacher who was telling me to shut up and do my homework and was giving me lots of homework, it didn't feel good, but I conceptualized it accurately as, well, if I'm going to learn something, my teacher has to say that to me. And when someone with narcissistic personality disorder harms us, if we take a second, you're like, well, okay, why are they doing this to me? Well, it's not personal. This has to do with their childhood. It has to do with their desperation for superiority to mask their deep, valley of devaluation that they feel. And so I get it. It doesn't necessarily mean that we put up with it, but it certainly does make it more accurate. All right, let's take a break. All right, we're back from the break. So this next question, what are some ways to reduce friction with a narcissistic person in a work setting? End of question. I'm guessing I'm going to get a lot of these kinds of questions. I already have. I don't know how to answer them because I don't know what you mean. Like I was saying earlier, narcissistic personality doesn't describe someone or their behavior really. It just describes their condition, but it doesn't tell me what you're dealing with, because a narcissist, quote unquote, narcissistic person could exhibit a whole variety of behavior. So I don't know what to say, but generally I'll throw out some options. One, you can avoid them. People with personality disorders can be so distorted in their perceptions and thus so problematic with their emotions and behavior that there's nothing you can do other than avoid them. And I've done that before with people with personality disorders at my work. There are people who I absolutely have diagnosed years ago with personality disorders and have tried to work with and just decided there's just no point. They will and did traumatize me. So I would just avoid them. So that's one option. The other is to, if someone is narcissistic, is to let them talk and value them. They want to talk, and so maybe if you have to deal with them, you would say like, well, I'm going to dedicate 45 minutes every day of where I just know I'm just going to listen to them talk and yammer at me for 45 minutes about things I don't really care about, and I'll just praise them for an hour because that's functional for my life or something. Of course, you don't have to do that, but if that seems to be one way to maybe get them on your side or something. Draw boundaries. Like I said, it's hard for me to know without having more context. All right, this next question. If a couple comes to you for therapy and one is narcissistic, how do you navigate the conversations without them feeling as though you are taking sides? This is a great question, actually. I don't think I've ever been asked it before. So there are many So this mainly pertains to early couples therapy because later in couples therapy, like the other day, I was, okay. Do I go into this? Yeah, why not? So as I've been telling y'all, my life is just extremely chaotic and busy right now. And I am managing, but I'm kind of discombobulated at times. Things will calm down over the next couple months, I think. Yeah, or maybe sooner. But this week, I was having a very chaotic day, and I looked at my calendar and I saw that I had a client at a certain time, and I don't have that many clients right now, so it's not like I have a whole 8-hour stretch of clients these days. And so, I made note of it. It's okay, I have to make sure I'm in my office and comfortable and ready to go for that session because I'm still doing phone sessions because Delta, blah, blah, blah. And so I went on with my day, and my day got real weird real fast and became very chaotic, and the dogs were involved, and dogs are okay, but just all these things going on. And then all of a sudden, my clients call me for sessions, so my clients called me, and it was a couple. And I didn't recognize the phone, and normally the phone number on my phone, and normally I don't answer the phone if I don't recognize it, but I thought, well, maybe I answer. So I answered it, and it turned out to be them. And I suddenly realized, oh my goodness, I'm supposed to be a therapist right now. And I wasn't in a mindset for it, and I was completely not in the right place. And so, why am I saying this? Oh, I'm saying this because I've been seeing this couple for many years, and I apologized up and down and explained that it had to do with life circumstances, and but I said that's no excuse. It's just I take this very seriously, and they said to me, "Look, we've been working with you for many years, and something like this happening, once in so many years." It is not going to concern us. They're like, we know you and feel safe with you to such an extent that you forgetting about an appointment isn't a big deal to us. We know that you care, that sort of thing. And so I say that because you can depend, if you've done your job right, on a very strong relationship years down the line that if you had a narcissistic member of a couple, you wouldn't have to have a lot of strategy around it because there would be safety for the narcissistic person. Anyway, so most of this has to do with early strategies. So, if a couple comes in and I notice that one person has narcissistic traits, and I wouldn't know that they had narcissistic personality disorder off the bat because it takes me a long time to assess that. But how do I navigate it? Again, I would be mostly concerned with the, sessions 1 through 20 or something. And one strategy is to, and this is, I think, maybe usually what I do, is I allow the person with narcissism to be superior. The couple has already oriented an adjustment for the narcissistic individual anyway. And so the partner will often be used to listening a lot. They don't like it, but it's not the end of the world to them. And so I might join the system by joining their rules of the game, which is to allow the narcissistic person to talk a lot and to have the other person not talk very much. That's not a very good feeling as a therapist, but I might have to do that in the beginning just to adjust and to help the couple to feel comfortable, particularly the narcissistic person. So I'm going along with some of the pathology with the couple in the beginning, knowing that I have to in order to get them to feel safe so that I can change it later. Another strategy is to talk as if the narcissistic person isn't narcissistic. So like one of the things that I'll do is, the narcissistic person might be talking over or might be having trouble with empathy or might be really self-centered and not concerned with what the other person's experience is. And so I will say something like, and I know that I'm doing this in a strategic way, I will say, well, I know that deep down you can see that your spouse is hurting. And because I just know you're a human being. Of course you care about your, so let me back up. So let's say that I had a couple where the wife is being vulnerable and the husband is being very self-centered about it. The husband is like, the wife is saying like, yeah, this marriage has been kind of tough on me and I really want it to work. But sometimes I get really sad. And the husband says something like, I don't know what she's talking about. Our relationship is perfect. I don't know. Some kind of thing like that. Well, I might say something like to the husband, I might say something like, okay, so I'm hearing this conversation and I think it's good. Husband, I think it's clear that, deep down you can feel the pain of your wife. I'm sure of it because you're her husband and you feel those things. And it might be hard to just feel that. It might be hard to see that without having it feel like a threat or something. So in this instance, I'm assuming humanness in the narcissistic individual, which of course is 99% accurate or likely. And I am speaking to that person for a number of reasons. One, I'm helping out the wife by saying, look, I know he just said something that was really insensitive, but deep down I know he cares, but he's struggling because of a threat that he feels. There's some kind of threat that he feels from that. The other purpose is I'm trying to lay the groundwork for self-awareness for the narcissistic person. Now, the problem with this is the narcissistic person could look at me and say like, no, you're an idiot, I'm leaving. And so I have to gauge that. The other strategy is to talk explicitly about taking sides. So I might be very down the middle and 50-50 in the first 20 sessions. And the narcissistic person is like, hey, this doesn't feel right. And I might say, so I'm getting the impression like you think I'm taking sides against you, but that's just not the case because what I am doing is I'm on both of your sides. And so that means that I'm going to listen to you a lot and I'm going to listen to your spouse a lot. And that might feel like taking sides, but I'm on both of your sides. I'm deeply on both of your sides. So I might have to talk about that very frequently. And along those lines, I might have to do a lot of repair work. And this is true for a lot of personality disorders, particularly cluster B, is the principle of it's okay to make mistakes as a therapist. It's okay to step on landmines. It's going to happen with personality disorders. but it's how you react to it afterwards is the key. Expect ruptures to happen and expect you're going to have to do repair work. In fact, with a lot of people with narcissism or borderline or histrionic, I just work it into my treatment plan. I'm like, okay, what's the likely landmine I'm going to step on, and what am I going to do about it? That might mean, like, I remember years ago I was working with a couple and I stepped on some kind of emotional landmine with the wife, and she became convinced that I had betrayed her when I hadn't, and was blowing out of therapy, and she didn't want to come back. And so, a couple weeks, or I think they said they would schedule. They're like, okay, well, we're having trouble with our schedule. We'll call you or something. And then a couple weeks went by, and it just occurred to me, like, wait, they haven't called me back yet. That's kind of weird. And so I gave it another week, maybe, and then I sent him a long email, and I said, so I haven't heard from you in a few weeks, and I'm guessing what happened was during the last session, I said or did something that really hurt your feelings. I'm speaking to the wife. And, I understand that, and I'm really sorry about that. I could see why that would hurt your feelings. Of course, it doesn't help that you have these traumas from your life that I, of course, am being insensitive about by not being careful around those issues with you. And I just want to tell you that I'm dedicated to you, and I really want to help. I don't know if that was over email or phone or whatever, but anyway. So I communicated that to the client, to the couple, and they came back. So that's an important step in the treatment of personality disorders that adept personality disorder specialists know very well, and a lot of therapists do not. All right, this next question is, you mentioned that the best depiction of narcissism is in the movie There Will Be Blood. The main character was not remorseful. Yeah, so just chiming in here, I don't know if it's the best depiction of narcissism. I might have said that, but it is among depictions of narcissism. It is that, and The Talented Mr. Ripley are two examples of depictions where I can actually get behind and say, yeah, I mean, because in my evaluation of movies, I can't remember the sort of criteria I was having, but I think it was, is there enough data that gives us enough reason to think that someone actually has a personality disorder like narcissism? Because some movies, there will be a little bit of data, but not enough to diagnose from afar, whereas a movie like There Will Be Blood or Talented Mr. Ripley, the movie is written and depicted in a way that there's a lot of data about personality and about narcissism. Now with Talented Mr. Ripley, you could also say borderline potentially. The other criteria that I had was, is it done in a way that is non-stigmatizing? Because I don't think that There Will Be Blood or Talented Mr. Ripley helps with personality disorders. Now, they're not trying to depict personality disorders, but I think they are. But There Will Be Blood and in Talented Mr. Ripley, spoiler alert, the individuals murder people, and whereas the vast majority of people with personality disorders never harm anyone in that way. And so, is it the best depiction? No, but if you look sort of at the personality traits rather than the sensationalized storyline, then it's one version of narcissism for sure. And like I've been saying, people with narcissism are not a monolith, But anyway, so you say here, can't narcissism, just like borderline, manifest in many different ways? Yeah, just chiming in here. Yeah, absolutely. Going back here. My parents made me doubt every thought or emotion I had. They always said I was wrong or to blame. They exploded in rage and allowed others to abuse me sexually and physically. They abused their own children. Yet they were two of the most nicest and kindest seeming people to the outside world, but they had zero insight into their behavior. It was so painful and invalidating to grow up that way and to have the outside world see something so different from what my siblings and I saw. Why does this type of narcissist never get talked about? End of email or question. Right. So what we have here are the facts that I'm hearing, which I do not doubt, is that your parents were abusive. Okay. They harmed you. They said you were to wrong. They said you were to blame and that you were wrong, and they never took responsibility. They exploded in rage and anger. They allowed others to abuse you sexually. They physically abused their own children. And yet, to the outside world, everyone saw them as nice and kind and wonderful and thought, oh my God, what a wonderful family. Okay, so those are facts. Now, what was wrong with your parents? That is a question mark. And you are telling me that your parents had they were narcissists. Actually, you're saying they were narcissists. Again, as I've been saying, I don't know what that means. Are we talking like they lack empathy? Like they're really self-centered or they're selfish? Okay. Or are we talking about narcissistic personality disorder? Because if we're talking about the construct of the disorder, I don't know based on your description that they suffer from that. Because there's a lot of roads to being abusive as a parent. There's a lot of roads to being abusive and narcissistic as a parent. You could be borderline as a parent and come across as narcissistic and be abusive. You could be psychopathic and antisocial and be abusive and harmful and exploitative and come across as if you're narcissistic. So I don't know, but let's just say that your parents did suffer from narcissistic personality disorder. What was going on there? Yeah. So, and not everyone with NPD is like this, but so you're devalued as a child and you learn, and maybe even abused as well. So you're modeled bad behavior, but you learn that you need to assert your superiority over other people. You might even need to assert your superiority in a physical way in order to feel good about yourself. And you learn this at the age of 2, 3, 4, 5 years old. This can develop sometimes when you have siblings that are all being neglected, and the siblings, in order to gain some semblance of self-esteem, will bully their siblings, that kind of thing. And then you grow up and you have no self-esteem. And so you have a spouse and you have children, and your children are disappointed in you because you're not a very good parent. You don't listen very well. You don't have a lot of empathy. And really, all kids are, most kids are snots to their parents. Any parent out there who has kids knows that your kids can be really insensitive to your feelings. It's one of the hallmarks of being a good parent is to, withstand moments of being devalued by your own children. And so, hashtag not all children, but hashtag many children. And if you have no self-esteem and you need to assert your superiority and you can't withstand criticism at all because it pushes back the curtain and reveals your vulnerability, then as a parent, you're not going to be a very good parent. You're going to react very poorly to your kids, and you're not going to react very well to criticism, and you're not going to react very well to your kids not worshiping you all the time. And so you might abuse, you might hate, you might get angry, and you might be very harmful to your children. You might not have any attachment to your children, and as a child growing up with a narcissistic parent, you might feel very, very bad about yourself and very harmed in that way. So that's how narcissism can lead to that kind of behavior. But you ask the question, can narcissism, like borderline, manifest in many different ways? I think you're asking this, in terms of can the narcissist in There Will Be Blood, can there be other manifestations of narcissism? Yeah, 100%. If I told you every case that I've worked with of someone who had narcissistic personality disorder, you'd be amazed at how different they all are. Different professions, different vibes, different, introverts or extroverts, or, nerds, or, shooting guns kind of people, or different genders, different sexualities, different, everything, just it runs the gamut. And, some of them were very caring. Some of them weren't. Some of them were good listeners, some of them weren't. Some of them were very annoying to work with. Some of them weren't. I will say I was lucky enough to work with a lot of people with personality disorders that were I don't know, I would say on the easy side of the spectrum, particularly later in my life. Early in my career, I feel like, I don't know if I just remember the bad ones, but I came across a lot of difficult individuals with personality disorders in my first, 5-10 years of being in the. All right, I got to race through. Let's get to another question. All right, this next question. What is the best form of treatment for someone diagnosed with narcissistic personality disorder? Yeah, good question. Well, it really depends on the goal. And of course, if you read the literature, they'll talk about certain manualized treatments that I don't really get excited about. But it depends on the goal. If someone with people with narcissistic personality disorder come into therapy for a variety of reasons. They might come in because their relationships are falling apart. They might come in because they're depressed. They might come in because they're being forced to, because they were violent or something. So there's a lot of different reasons why someone would come in. And then even when you have different reasons, you have different objectives. Are you focused on awareness, or they're improving their relationships or emotional regulation? Or are you interested in getting rid of the personality disorder altogether, which does happen? I've treated people with several different disorders and found that by the end of the treatment, period of a few years or more, they didn't meet criteria for the diagnosis anymore. And so what are we looking for? Are we looking at 20 sessions of awareness of narcissism, or are we looking at 300 sessions of eradication of the symptoms? So there are many different forms of therapy that can help. Obviously, anything involving emotional awareness and regulation would help. But the key, I would imagine, for most people with narcissistic personality disorder is that the clinician understands what the disorder is, understands where it comes from, and thus understands how to cure it, how to help someone, even if it's in the short term. I treated people with narcissistic personality in the short term, and I knew where the landmines were, and I knew how to put them at ease. I knew how to help them feel safe, because that was always the thing. People with narcissistic personality disorder, if they feel safe, which is actually really hard for them to achieve given their schemas, but if you can make them feel safe, they stopped acting narcissistic. They start acting like a balanced human being. Same with borderline or any personality disorder. If you can help them feel safe, they don't need to adjust their world to feel safe. Narcissism is a desperate attempt to achieve safety. Now, it doesn't work for them because they're using they're using a method they learned when they were 2 as a way of coping with the world. It's not working for them, but that's why they're doing it. So if you can make them feel safe, then they don't need to do those things anymore. Anyway, so forms of therapy, if it was psychodynamic and it understood narcissism, if it was schema therapy based, I imagine that would be pretty effective. CBT, if they understood narcissistic personality disorder, DBT, pretty much any form of Gestalt therapy. I could, internal family systems, really any form of therapy, as long as it understood the foundation of narcissism, I think would be fine. All right, this next question is, covert narcissism seems very subjective. I worry that this label could be used against someone. Sometimes just describing a difficult life can sound like you are expressing a victim mentality. What is the difference between someone who genuinely has had a very challenging life with little hope for change and a covert narcissist? End of question. So in order to understand this question, I feel like I have to read between the lines. So it sounds like this person is saying, look, I am, or I know someone who has genuinely had a very challenging life. And when I talk to people, people might label me as being a covert narcissist because on the internet, it says that covert narcissists will have a victim mentality. That's what it sounds like this person is saying. So if that is true, which I'm, obviously making some guesses here, labeling someone or diagnosing someone as a covert narcissistic personality disordered individual based on someone describing their life as being difficult is absurd. So, and it's just more evidence that the internet needs to calm down regarding their usage of these extremely complicated and I've said this before, I went to graduate school for many years and taught for many years about narcissistic personality disorder and did not understand the disorder until I worked with dozens of people with the disorder and matched that up with the literature and matched it up with, the 150 years of psychoanalytic literature. And then I barely understood it. Then I did a deep dive on narcissism a couple years ago and understood it a lot better. And I thought about it more and I treated more people. And so to understand narcissistic personality disorder or covert narcissism as a part of narcissistic personality disorder, that is my path. That's 25 years of, off and on reading, treating, getting supervision, thinking, podcasting. And then an understanding emerged. You can read the symptoms, but that tells you nothing about what it is to experience someone with narcissistic personality disorder. So, and all the different manifestations of it and all the different kinds. And so, anyway, but you're like, it sounds like what you're saying is the construct or the way covert narcissism is described. Well, the first thing you says is covert narcissism is very subjective. Yeah. Narcissistic personality disorder is subjective. And this would drive people crazy when I would say this in graduate school, particularly professors that were teaching certain classes. I'd be like, so, it's sort of in the eye of the beholder, right? And, these professors, no. Narcissistic personality disorder, borderline personality disorder, this is a real thing. And we use our instruments and all of our scientific power to determine if someone has the disorder. And in the back of my head, I'm like, do you not understand these are subjective things. It's not a hard science. You're making a judgment call as a clinician. And I applaud you and I do it too. But to claim that you have some kind of hard scientific evidence in the same way that someone could point at the sun and say the sun is X amount of miles away from us because of using lasers and triangulation and stuff. And Einstein's theory, we can determine how far away the sun is. That's hard science. Labeling someone with narcissism is not hard science. It's a subjective call. You're using all your powers of your clinical powers and education and you're doing it in the effort of trying to treat someone, but it's not a hard scientific thing. Anyway, so the notion that, you're saying isn't covert narcissism seems very subjective. Yeah, 100%. Now, what is covert narcissism? Well, it's complicated, and listen to my whole deep dive that's available to patrons only on narcissism. But in a nutshell, covert narcissism is full-blown narcissistic personality disorder, but the person is in more connection with their deep inferiority. And they're often not outwardly grandiose. So they're more like quiet narcissists. They might be less entitled. They might not brag as much. They can be shy, actually. And essentially what's happening is that it's much more internal, the narcissism. They have a deep inferiority. They have a deep need for superiority. And they're sort of quietly and secretly superior to other people. They might also kind of know that it's distasteful to come across as a narcissistic individual. And so they have all these elaborate stories that they tell themselves about their grandiosity, but they don't share it with other people because they know that would make them look bad, and they don't want to look bad because they want to seem superior. And to be a braggart makes you look inferior. And so covert, the reason why it's called covert is because the narcissism isn't very easily observed, whereas an overt narcissist is pretty. You'll notice them right away. They overtalk, they brag a lot. They seem very interested in letting you know about how awesome their car is or how beautiful their wife is, or they're always bragging. They're always making sure that their superiority is known. Whereas the covert narcissist, you just won't notice it as well. They're suffering in the same way, but they're hiding it because they don't want to come across as inferior. They don't want to, by asserting their superiority, they don't want to become inferior. And or they're, like I said, they're kind of in connection with they're vacillating more often between inferiority and the superior veil. And they might have longer bouts of time where they really do feel like a piece of crap. So your question is, what is the difference between someone who genuinely has a very challenging life and little hope for change and a covert narcissist? Well, I would say everything is different. I don't think those. So it sounds like what you're saying is you're reading on the internet that people who talk about their victim life, their victimhood, that's a sign of being a covert narcissist. What? All right, so next question. Hi, Dr. Kirk. I've often wondered about how highly narcissistic person views and experiences their world. For instance, when in conflict with a loved one, are they aware of using dirty or toxic argument tactics, or are these unconscious habits sprouting from an underlying narcissism? Thanks a bunch. From Patron Steph from Calgary. So this is a good question, and this is one of the misunderstandings that's on the internet and among the lay folk and among many clinicians, frankly, as well, is that, narcissistic people are not aware that they're doing narcissistic things, usually. Personality disorders, in a nutshell, is a perceptual problem. To the borderline, they see abandonment where it doesn't exist. To the narcissistic person, they see devaluation where it doesn't exist. And so when they see things that don't exist, and that's why we called them borderline, was because in the early days of psychoanalysis in the 30s and 40s, psychoanalysts thought these people were delusional because these people saw abandonment when it wasn't there. And they almost like invented things that you said that you never said. Abandonment type things. And they're like, I think this person is like paranoid schizophrenic. And then over time, they're like, no, they're more sort of borderline schizophrenic or borderline psychotic. And so it is a very strong perceptual distortion that these people have. So when you feel like you're being devalued, then you feel very, very hurt and very, very harmed. And when you have this perception that you're superior and you deserve everything, you have this perception of entitlement. It's not a choice that you make. You have this really, really large perceptual distortion that you're entitled to things. And someone steps on your toe and you're like, even though they didn't step on your toe at all. Like an example would be for a sort of classic narcissist is, you are friends with them, or you're friends with them, or you're an acquaintance, and you say something like, hey, I got a promotion at work. Well, to everyone else, they'd be like, oh, good for you. Or they might have a little bit of jealousy. But to the narcissistic personality disordered individual, this really, really hurts them because they're like, whoa, that person just got a promotion. I want to get a promotion. Everyone's looking at him as if he's doing well. And no one is looking at me right now and saying I'm doing well. And therefore, everyone thinks he's better than me. And he thinks he's better than me because he got the promotion. And I feel like crap right now. I feel devalued. He is devaluing me. Everyone in this room is devaluing me. Okay, that is the distortion that's happening with narcissistic individuals. It is not a choice. It is not rational. You understand? Personality disorder, and this is the way they talk about it on the internet. You got to watch out for the narcissist. He knows how to get you. It's like, no, he doesn't. Now, if he's a psychopath and a con artist, then yeah, he knows how to get you. But if he's a narcissistic personality disorder individual, he is operating on vast amounts of fear, and so he's trying to survive minute to minute. Regardless of gender of the individual. Anyway, so when you say you got a promotion and this narcissistic individual feels threatened and harmed and devalued, and the world is crumbling underneath. It's sort of like in American Psycho when the other guy gets the cool business card. The inner dialogue that you hear Patrick Bateman saying is a narcissistic threat. And so that individual feels harmed. They feel very much like they're being transgressed upon. They get very hurt, and then they get very angry. And then they exhibit behavior towards you that outsiders would label as dirty or toxic. So yes, it is not volitional. They're not like, today I'm going to be toxic. No. All right, this next question. When dealing with someone triggered because of their own narcissism, is there any behavior that will calm them? So is there any way to calm down someone who was triggered in their own narcissism? It's hard to generalize, but I think some things to think about are to understand their trauma. If their trauma is devaluation and that's being triggered, then you want to value them. A lot of time in early therapy with people with narcissism that I treat, I spent a lot of time valuing them in the way one might value a 13-year-old, in a way that a parent might value a child and say, you're special. I see you. You're a good person. I see you trying. This sort of things that a parent might say. So maybe that would help. Listening might also help, because giving people with narcissism space is calming to them, depending, of course. The topic of vulnerability, you might want to avoid or dive into. It depends on who you're talking to. But, some people might be even more triggered if their vulnerability is highlighted, but others, they might actually benefit, And the clients that I worked with, that was always what I was trying to get to, where as they were triggered in therapy, I would actually move into their vulnerability in a safe way. And so as they're being triggered, I would go further into their vulnerability in a caring way, and that would help them and help calm down. Maybe try to avoid pushing things. Again, it just depends on who they are, but I'll just say that. All right, this next question. I have some narcissistic traits, and I want to know, what is the difference between narcissistic supply and the basic need to get some attention and praise from others? I am prepping for a major career move and have a lot of support and enjoy the praise about my progress, but I am afraid I'm doing all this out of a narcissistic need rather than because it's the best thing for me in the end. End of question. Yeah, that's a really, really great question. So essentially what they're saying is they've recognized they have some narcissistic traits. And right now they're moving up in their career, and they're getting a lot of support and really enjoy being recognized for their achievement and their progress. And as everyone would. But are they only doing it because they're trying to get narcissistic supply, or are they doing it because it's the best thing for them overall? Well, there might not be a dichotomy, like for me being 5% on the narcissistic spectrum, I get some of my narcissistic supply by y'all being nice to me, which I thank you for, by the way. Being communicative about that is nice. So there's that. And I also know that this podcast is a wonderful outlet for me, creative-wise, provides a tremendous amount of purpose in my life of trying to help others and to improve, and increase compassion. And so it provides some narcissistic supply and some, good things. So it's not a mutually exclusive thing. But the key difference, my friend, is it meeting your core needs? So narcissism and narcissistic supply are coping mechanisms to devaluation, right? But so the question you ask yourself is, okay, as I am moving in this career and getting praise, is this meeting my needs, like my need for feeling like I'm like I accomplished something? Is it meeting my need for some recognition and attention from other people, some kind of normal need for attention? Or is this purely out of desperation and running away from devaluation? Now, that might be a hard thing to determine because potato to some extent. And when you have narcissism, when you're higher on the spectrum, you also lack a sense of who you are. So you lack a sense of your own needs. So it'd be hard to know the difference, to be able to recognize your needs. But that's the key. Well, one of the keys of recovering from any personality disorder is knowing who you are and what your needs are, because that is really the cure for a lot of problems in life is, who am I? How am I feeling? What do I need? Because if deep down at your core is a need for achievement and some public recognition or support or praise, and it's just a part of who you are, you like that. The actor who likes the applause, or the stand-up comic who likes the laughs, or the artist who likes the people saying, that's an interesting looking painting. That's an okay need. It's a normal human need that people have varying degrees of and various manifestations of. But in order to know that that's where it's coming from, you have to be in touch with who you are. And that's a very amorphous thing, but that's how I'll answer that. All right, this next question. I grew up with a mother who demanded that me and my siblings perform perfectly to reflect well on her and her narcissism. Our entire family revolves around managing her feelings and her self-image. I know she's a complex person with real feelings, but as an adult, I have a hard time understanding why she doesn't see us as individuals and still sees us as a reflection of her. This is not what the internet defines as narcissism, though, as since people on the internet seem to think people with narcissism, their actions are intentional. But I really think my mom has no idea she's harming us by relying on us to all be perfect. Can you further define narcissistic traits or tendencies without just blanket individuals as a narcissist? Blanket labeling? Anyway. Can someone have some behaviors but not be acting from an evil place? End of question. Yeah, I think I've already covered this, but what this individual I think is saying is, my mom is narcissistic. She would abuse us and demand that we do everything perfectly, because if we weren't perfect, it would reflect badly on her. And she was so vain and so needy of being seen as perfect to the outside world that she was willing to sacrifice her relationship with us to make her look good to the outside world. And this was very harmful, but I do not think it was intentional. I think she literally just saw us as extensions of her. And the internet, though, sees narcissism as this intentional evil thing. So, yeah, I mean, as you know, don't even get me started. The internet, so attachment theory, the internet does pretty well with. Narcissistic personality disorder, the internet is very bad with. Borderline, the internet is 95% bad. The internet, when it comes to narcissism, is like almost 100% bad. So I don't know, it's kind of weird, Again, I think it's because all of us have experienced people who we thought were being selfish in relation to our needs. And it just feels so good to label someone, they're evil and they have narcissistic personalities, or they're a narcissist. And it's vindictive, that person hurt my feelings and I'm going to get him back with this evil label, but it's not an evil label. Anyway. So yeah, let's, review what this person is saying. They're saying that my mom was narcissistic and, by extension, she, as a child, was neglected, or, something happened to her that she felt extremely devalued. And let me go in a little bit of detail about that devaluation. So for some people, you can be devalued in ways that are very obvious, being abused, but you can also be devalued in ways that are very, maybe harder for us adults to understand. When you're 1 year old and your mom got sick for 6 months and was in and out of the hospital, as a 14-month-old person, you might feel devalued, even though you're not being devalued, even though your mom is coming in and out of the hospital and desperately trying to get back home to spend time with you, and is, loving all over you when she's around you, but she's just in and out of the hospital. And so that can make you feel devalued, and that can result in the need for narcissism to cope, and then that sustains until adult life. But anyway, so this person's mom had some kind of devaluation trauma and developed narcissism, this desperation of, I need the world to see me as perfect. I need to believe that I am perfect. I need the world to be, I need things that reflect on me to be perfect, because if I'm not perfect, then very, very bad things will happen. Another part of the trauma coping early in life that might be present, not always, is that the child learns if they are grandiose or superior in some way, they'll get more attention. So that kind of locks it in, right? So this mother grew up with that, and then ends up having her own kids, and lacks a sense of self, is in constant anxiety about being seen as inferior. And everything this mother does is trying to make her look perfect to the outside world. And since her kids are a reflection of her and maybe defined by her or society or something, she, stomped all over her children in order to make sure that her children were perfect, so that the world would see the children as perfect, and thus she would be a perfect mother. And she is not happy. She is in a constant state of suffering, of anxiety, of devaluation. And that resulted in this person who wrote in their experience. So there are many different manifestations of narcissism, and when we see it accurately, there's nothing evil about it. It's a bad coping mechanism to a terrible situation that can cause people to harm others. This mother abused her children by making her children feel like they didn't matter. And that's what's so insidious about this, is that it spans generations. When you become devalued, you tend to devalue others, and thus the cycle continues. Not always, but sometimes. All right, this next email or next question. My mom's mom, my grandma, seems to have a narcissistic personality. Her mother, my mother's mother would play one sibling off another. She would tell my mom she was the cause of arguments between the parents. As a 7-year-old Catholic girl, my mom was told she was the devil's daughter. How can my mom live with negativity, judgment, and pressure to comply? My mom would like to know the long-term effects of daughters with a mother who did not hug or kiss or tell her that she loved her. End of question. Well, I'm sorry your mom went through that. I'm glad your mom can see it for what it is and that it's not the mom's fault. Obviously, going to therapy is the answer. You're asking how can your mom live with negativity, judgment, and the pressure to comply? Your mom was abused emotionally by her own mother, right? Like, it's one thing to be harmed. It's another thing to be chronically harmed and neglected by your own parent. That is a lot to untangle, and therapy is the best answer for that. Next question. I think my grandma has narcissistic personality. I want to cut my grandma out of my life, but I feel tremendous guilt about it. What if she dies soon and I wasn't speaking to her? But it is impossible to have a normal relationship with her. How do I deal with the guilt? End of question. Yeah, I get this question very often, very frequently. And I'm not saying that it doesn't annoy me, but the reason why I'm saying it is because it points to a lot of people with this question. A lot of people are dealing with this question. We have a society, for I think good reasons, that promotes this idea that you don't reject your elders, so you don't reject your parents or your grandparents, and that there's many movies about like reconciling with your dad who you had a difficult relationship with, and just how beautiful it is to reconcile. And we don't have a lot of movies or stories about rejecting one's parents as a way of prevailing. One movie that pops into my mind is Forrest Gump, when Jenny, it was implied, was being abused by her father, and her rejection of her father, and then how they bulldozed the building down. And so I think there are, glorified stories of rejecting one's abusive caregivers, but there's not a lot. And so I get this question a lot, and I get the dilemma, because on one hand, there's a lot of guilt. The thing you want to ask yourself, is that guilt from the inside or is that guilt from the outside? Because if it's guilt from the outside, meaning you feel guilted by others, then you really shouldn't regard that. That's not a good, usually, not always, but it's not, in this instance, I don't think it's such a great guide. But it might be guilt from the inside. Maybe you should be doing more. Maybe you shouldn't cut her off. Maybe you should just draw some boundaries. But it comes down to, what do you need, And the other thing I'll say is that this is a tough decision. There's nothing I'm going to be able to tell you to know what to do. And you're not asking me for that. You're asking, how do you deal with the guilt? Feel the guilt, just feel it. So what is the guilt telling you? Is the guilt a very good guide? There's no good answer to this, because there's no, I wonder sometimes if, as Westerners, we think that there's an answer to all life's problems, and there is not, definitely. And in this one, there's not. So on one hand, you stay in it and you uphold, you don't feel guilty, but you're being abused, essentially. Or you leave and you're free and you're no longer being abused, but you have guilt and you may be being shamed or guilted, and you're worried that, what if she dies and I wasn't, I blew her off and I wasn't there for her. You're going to feel the guilt. So, but the thing is that's not your fault. That's your grandma's fault. Your grandma is putting you in that position. So don't blame yourself for that. All right, so next question. True NPD means the person lacks insight into their behavior, not just that the person's behavior is selfish. Could you discuss what lack of insight means and how it looks in session when working with someone with narcissistic traits or narcissistic personality disorder? End of question. Yeah, it's a good question, and it, the person asking the question understands what we've been talking about thus far, which is that it's not the person just being selfish; it's they lack insight. And what that looks like is, as I've been talking about, a misinterpretation of threats of devaluation. They see threats of devaluation everywhere and are very sure of it, and feel very, very scared of it, and are very hypervigilant and hyper-focused on making sure that everyone understands that they have value. So they lack insight into that, in that they distort and completely exaggerate these threats. The other thing is that they lack insight into their denial of emotions, dependency, and vulnerability. And this is something I work on a lot with people with NPD, is understanding that they have emotions, understanding that they have dependency and attachment, understanding that they are vulnerable. And I know that I've reached a certain phase in treatment when they, as clients, will come to me independently and say that they are trying to get in touch with their vulnerability. They're terrified. People with narcissism are terrified of not only recognize their vulnerability, but particularly expressing it. It is terrifying to them, because often their trauma involves a denial of their vulnerability when they were young, meaning that they were very vulnerable and expressing it when they were 18 months old and no one cared, repeatedly. So, they absolutely lack insight into that. But, therapy is about discovery. And when we discover those things, I almost always see clients light up with excitement and validation of like, because deep down, people with narcissistic personality disorder can seem like they don't care, can seem like they don't have emotions, can seem like they don't depend on anyone, like they don't need anyone. And they believe that about themselves. But deep down, oh boy, do they have emotions? Do they have needs? Do they depend on others? Do they desire to just fall into someone's arms and have that person take care of them? They desire it perhaps more than anyone else on the planet. And so when we get there, it all comes pouring out. Not without its transference and those problems, though. All right, next question. Can a true narcissist ever overcome his or her narcissism? Yes. I've already answered that, I think, sufficiently. Yes. They can, quote unquote, overcome, meaning that they heal from their traumas and thus don't need the defense mechanism of narcissism and thus don't exhibit the behaviors that qualify them for the diagnosis. Next question. Is being narcissistic something that you are doing in order to keep safe? Just chiming in here. Yes. Going on. Are they narcissistic so they don't have to be vulnerable? Just chiming in here. Yes, absolutely. Because there's this idea that if you come across like you don't have any needs and that you're superior and you've got it all figured out, that's sort of the opposite of vulnerable, right? But because they have vulnerable traumas about their own vulnerability, they not only are terrified of expressing their vulnerability because they don't want to be harmed by others, but they're also terrified of even letting other people know that they're vulnerable because they don't want other people to, it's sort of like you're a 40-year-old woman and you have narcissism. You don't want other people to know you're vulnerable because if other people know you're vulnerable, then one, they might make fun of you in a way that you felt made fun of or devalued when you were young about your vulnerability. But you also feel as though, not all the time, but you also might feel as though if they see my vulnerability and they don't take care of me, then that's also kind of a rejection of my vulnerability, if that makes sense. You also don't want to recognize your vulnerability to yourself, because if you recognize your vulnerability, then you also have to recognize that no one is loving or no one is taking care of your vulnerability. And that's very, very painful to the narcissistic person. You also ask, so their weakness will be, do they feel as though they are imposters and therefore put up this narcissistic attitude? Yes, but depending on their level of pathology, they might not be aware of that. There are people suffering from narcissistic personality who are so deeply, brainwashed by their own narcissism that they believe that they're superior, truly. And they walk around with most of their conscious mind believing that they're superior. So the feeling of being an imposter is deeply, deeply buried. However, there are some people with narcissistic personality who have a much closer connection with that feeling of inferiority. And the very, very last question, and by the way, there was a whole, I asked for questions of gaslighting as well. I'll do an episode on that later, but this is the last question about narcissism. Is narcissism all bad? Just a very simple little question at the end. Is narcissism this question was just snuck in before the deadline. Is narcissism all bad? I think I've kind of answered that already, but if I was to come up with some positive aspects of narcissism, research, I seem to remember, it's not in front of me, demonstrated that it might be protective against certain kinds of, troubles in life. Like if your spouse dies, I think narcissistic individuals have more resilience because they don't depend on other people as much. Avoidant attached individuals are also kind of like this. I don't know if that applies to narcissism, but I think it does. I would say overall that's a bad thing, but I guess in the instance of trying to be resilient with loss, it's a quote unquote good thing. As we were talking about earlier, you might achieve a lot more with narcissistic motivation. Lower levels of narcissism, as I've been talking about, can be very helpful. And the drive behind this podcast, like I've been saying, it is partially narcissistic, and even the narcissistic elements of wanting to make the world a better place. I mean, who am I to think that I could do that? But having a dash, a 5% of narcissism. Actually, I don't know if this is exactly true. And if Bob were here, he would say, Kurt, come on, don't say that about you. But when I first started the podcast over 13 years ago, even before I started doing it, but even as I was doing it, and it was a pretty bad product for the first number of years, I had this vision that the podcast was going to be huge. I mean, not like it's going to, I don't know, be like huge, but like in the podcasting world, I felt or hoped or, geared my life toward this notion and was very motivated throughout the time of the podcast that eventually the podcast would be relatively big. Like I said, a relatively big podcast is actually very small compared to like a big YouTube channel or a big TV show or something. But I remember in the beginning just feeling like, I know this can be good. I know it can be big. I know that we have the basic components of something that could be amazing if we could just get enough people to know about us, or if I can just kind of fine tune the product just a little bit more. I feel like this is going to be big. Now, why did I think that? Particularly because there was no evidence of that. Two, in the early days, the product was pretty bad. So why did I think that? Was it delusional? Was it narcissistic? Was it a delusion? Was it a narcissistic delusion based on this assumption that I'm superior and I'm awesome, and of course my podcast is going to be the best ever? Or was it based on some rational assessment of the landscape of podcasting in 2008? So one could say that a good side of narcissism in me was that, was it the wagon leading the horse? Was my assumption of it being good led me to persevere, and then eventually I figured out how to make this thing good? Or did I always know how to make this thing good, and it just eventually got like known to be good or something? So, mild narcissism has its pluses. Is the question, is narcissism all that bad? The answer is no. But there is a tremendous amount of suffering for both the individual with narcissism and those around them. Well, thank you all for submitting your emails and your quick questions on the survey about narcissism. Tune in later when I answer all the questions about gaslighting. And if you are not a patron and you want to listen to the full deep dive on narcissistic personality disorder, you can do so now by going to patreon.com, become a patron of the podcast, and then you can listen to the episode. One of the easiest ways is to go to the website once you're a patron, but anyway. And everyone out there, please take care of yourself and take care of others and listen to others and know your needs, because you deserve it. You really, really do.